Good morning, everyone. My name is Dave Doherty. I am a Master's of Public Health student at Stockton University. I'm also a senior registered environmental health specialist with the Burlington County Health Department. And today I'm here to talk to you about vaccine hesitancy, um, and how we need to be addressing it with both cultural competence and confidence. So, what are we going to do today? Well, we're going to define the problem. What is our problem? We're going to define vaccine hesitancy and why this is happening. We're going to define why it's a problem. Who is affected by this? Where do we need to be looking not just at the nation as a whole, but what subsections and where do we need to make changes for these subsects of our population? What communities are we seeing this in, and what do we risk if we continue to not have the success that we need? And how do we gain that success? How do we get back on track? Where do we go to learn about this? Where do we send our patients to learn? Where do we send the public to learn? And where do we need to learn more? And how can we do this better? So let's start with the problem. What is vaccine hesitancy? And the World Health Organization says vaccine hesitancy refers to the delay in acceptance or refusal of safe vaccines despite availability of vaccination services. And it's important to note that it's a spectrum. It's not just I'm in or I'm out. There are people who are innovators, and these are the people who will jump into clinical trials. They will try anything. If you are giving out an extra shot, they'll take it just to make sure that they're ready to go. They are the very small group that allows us to be able to make sure that things are able to work for the general population. And then you do have the early adopters. When it comes to things like the COVID vaccine, there was a tiered rollout, a lot starting with healthcare providers and the elderly and medically vulnerable. But everybody did not jump at this in all of those groups right away. Some stayed back and waited. They wanted to see what happened when, we had the innovators who had a 50-50 shot of actually getting the shot because we needed to have a randomized control trial. So we needed people who just got regular blind shots. And then now everybody was getting the shot. So we had, again, two groups, a control group where everybody was staying the same and not doing anything about it. And people who were getting the recommended dosages for the vaccine at that time to bring up their immunity and see where things were going for the larger population as a whole. And after those early adopters came the early majority, the people who did want to see more numbers, who wanted to see what would happen. Maybe it scared some people away from the Johnson and Johnson shot because we did start seeing, although it was a one-dose vaccine, we did start seeing some issues with women's health. So they may have backed away from the Johnson and Johnson and chose to go to the mRNA vaccines that were available from Moderna and Pfizer at that time. And then we had the late majority. And these are a group that they're resistant to change and adopting new technologies, but they when things become mainstream and well tested, when people weren't falling dead in the street, when people weren't growing a third arm as much as we all would have liked one from an mRNA vaccine. Um, and everything was continuing to get normal, and people were still getting sick, but they weren't ending up in the hospital. And they said, all right, well, there's a little bit of force behind it too because of mandates that were in place before rulings in the Supreme Court. And they said, all right, I guess I'm going to have to do this if I want to get back to my normal. And then we have the laggards. These are the last people who will adopt a new technology or a new need. This could be people that are absolutely just forced to do something. So maybe a household member became medically vulnerable and the medical professionals told them, look, you really need to get this vaccine in order to protect them. Or um, mom and dad were having a new child and they had never taken any inoculations in their life, but one of them has an Rh positive blood and the other has an Rh negative blood. And in order to protect both the fetus and the mother, they need to get a dose of a medication that helps combat those incompatibilities in case something ended up happening. And it's important to note that there are some people who are never, ever, ever, ever going to do something in the laggards group. Everything is going to stay the same. I'm not going to accept this new change. And really how these groups form is because of what we call the three C's: confidence, complacency, and convenience. The confidence in that the intervention is safe and effective. We trust the system. People who are creating this did things the right way. The FDA and the CDC are making sure that we're safe, and we trust the decision makers, those who are in charge of making those decisions, as well as our elected officials who have made these mandates because they are doing something that we expect of them. Um, and then there's complacency. There's a perception of risk. I don't work in healthcare, so I'm not at risk for being exposed to pertussis more often, or I don't work around children. I don't have young kids, so whooping cough isn't a problem for me. I don't need to get an updated Tdap vaccine. Um, Meanwhile, they are putting themselves at risk for tetanus because it's in the same vaccine. That's what the T in Tdap stands for. And in reality, this lack of perception of a risk is because we're a victim of our own success. We've eliminated things like the measles and polio and diphtheria, and pertussis is at a very small amount in our population these days. Because vaccination has been mandated for so long, we don't see these diseases anymore. That's why we don't have people living in iron lungs that are young anymore. We're looking at the last of that generation that has polio. We're not watching children suddenly who were healthy and well become disabled because of neurological damage anymore. We don't see the risk anymore. We don't see the infection of measles, that just the rash and the effects that it can have on the central nervous system if it makes its way into the spinal column. And then there's convenience. And this is the availability, the affordability, uh, the geographical accessibility, and appeal of the immunization services. And this isn't necessarily just something that happens because, oh, well, I can go down to CVS. Recently, we've seen changes in, and I'm going to keep going back to this because it's such a hot button issue right now. We've seen COVID-19 vaccines become much less available to people. And really, it has come down to state by state things. Though the federal government has limited it to those 65 and over and adults who are considered more medically vulnerable, and they didn't really define that, which left a wide berth. So you have states where they are taking that in a very narrow approach and needing to have medical proof of what is going on versus states like New Jersey, where I myself, though I am in an increased vulnerable population, being a healthcare worker part time as well, I just had to fill out a form online on CVS, and I walked in, and when I did so, the clinician, the staff member who was giving the shots that day, the pharmacist, looked at me and said, "You're here for your shot? Good for you." No questions about what my medical vulnerability was. I'd like to think that I don't look like I'm 65, but I've been told I look older lately, and it's not always such a nice feeling. But on that day, I didn't care. Whatever got me in, got me done, because I have been an adopter of this. And in fact, the one year I didn't get the vaccine is the one year that I tested positive for COVID. And that was a matter of inconvenience. So you see how this layers, like from a macro to micro standpoint. Granted, I know I'm only speaking from one experience, but there are similar experiences and reasons. And also, we need to make sure that we're addressing things that make availability seem and risk seem more realistic to a person. And that includes language barriers and clinic hours and making people aware um, of the both risk and availability of vaccines for more common and um, older diseases as well. There's always especially around this time of year, a campaign about whooping cough because babies who are coming over from other countries are unvaccinated, and parents may not know about whooping cough. So we need to make that available. We need to make it available in a language that they understand. Um, and Another campaign that's been really big has been respiratory syncytial virus. That is something that you and I may just have a difficult cold with, but the very young and the very old may actually end up with severe illness, and deaths do happen from respiratory syncytial virus, RSV, every year. So we do need to make sure that we're getting vaccinated for that. And why is this a problem? Well, we're going to go over some numbers. We're going to talk about women and minority health and minority women health, women's health as well. We're going to talk about education level. And like I said, it's going to be a recurring theme. We're going to go back to COVID-19 and how it has really accelerated a lot of the anti-vaccination and vaccination hesitancy movement that is really what is exacerbating this problem today. And the numbers don't lie. In At the end of 2020, in the United States, 72.8% of the population was vaccinated, and we really missed our healthy people 2020 goal of 80%. And this creates herd immunity concerns, right? For the highly virulent infections like something like measles, we have that has an R naught of 15, which means for every one infection, 15 other people are going to get infected. It means we need to have a really high number. We like to aim for 95. If you do the math, which is 1 minus 1 over the R naught, so 1 minus 1/15th, it comes out to about 93.3%. So we like to aim for that little bit higher number so that we're within a margin of error to make sure that we're getting that full coverage. Um, and and this hesitancy is causing problems for everybody. When it comes to childhood vaccination series, by the time you're 2 years old, you should be fully vaccinated. For Black non-Hispanics, children are 10% less likely to have been completely vaccinated than their white counterparts. This is entries into school. This is entries into the vitals of education. And this starts at pre-K. There's countless studies out there that show us that pre-K leads to long-term success in education, and that's going to be important too in just a moment. But when our children are getting sick and not getting what is available to them, we have to ask why. Is it because mom can't get the child to a clinic? Is it because doctors aren't available, doctors' appointments aren't available at convenient times or at the scheduled pace that is needed? Is there some cultural barrier? We do know that the African American community is very hesitant with public health and trust in it because of things like the Tuskegee experiments. That has had multiple generational effect, and it still is brought up as something to be scared about in populations, even though we have made leaps and bounds to try to make sure that it is not a thing anymore. Um, and this is also important when it comes to women's health, especially for Black women. Those who are 19 to 26, they're 20% less likely to have received an HPV vaccine than their white counterparts. And this is important because this increases their risk for cervical cancer. And those who study cancer also tell us that minority women are more likely to get cervical cancer. And if while we can't stop all parts of it, I mean, we all remember Henrietta Lacks and her cases. And those cells that we still use, those base cells that we still use to this day to study cancer growth and development. We have Black women who are more prone to this same cancer, and they're not getting a vaccine that helps prevent at least four causes because it stops four strains of the HPV virus. Um, to stop the development of infection and cancer, hopefully. And there is emerging science that may suggest that this also affects um, gay men and men who have sex with men, and their increased risk to develop colorectal cancer from the same viruses and same infections as well. So there's been a bigger push to inoculate men, not only to prevent the transmission of the virus to young women, but also to prevent the virus to other men that they're having sex with. And education plays a huge role in this, right? Um, the education level is related to vaccine hesitancy, and it's an inverse proportion. You can see by the graph here from the study by Karp and his colleague and their colleagues, lower education correlation with high vaccine hesitancy, right? So on this Likert scale that they have here, people were asked one simple question: are you likely to get the COVID-19 vaccine? Um, and they said that people who were very likely to get it would rate a zero, who were definitely getting it would put in a zero, and those who would definitely not be getting it would rate themselves at a five. And then they were asked about their education level and some of their background. And as you can see here, the people who partially completed high school were actually very less likely um, to get the vaccine than those who had completed at least a 4-year degree, if not more. And the question was, why is this happening? And the reason that some of this is happening is how we get our sources. Um, for the more educated, we are looking for scientifically reviewed, peer-reviewed, properly published and replicated studies to tell us, yes, we know that this works and we know that we can keep making it work. Well, others, and for sometimes for some of the more um, fun things in life, those of us who are educated as well, we seek a confirmation bias, and we do that through social media. Social media is designed to keep us engaged. It's not designed to challenge us, right? So we seek a confirmation bias. We as the feed gives us, as we tell the feed what we think, it gives us more of that to confirm our stance or our belief. And when we are getting what we have, what we want, we are motivated to reason that that is the right thing because we seek out the information that confirms our beliefs before we go and seek out something that would challenge them. We want to feel like we're right. We want to feel comfortable in our own thoughts. And the fact of the matter is that sometimes our thoughts are wrong. I am wrong that I want to go more than 65 miles an hour when I'm driving on the highway because that greatly increases my risk of serious injury or death and those around me on the roadway. But I like to know that I can drive and be told by a lot of police that if we're doing under 80, we are very likely not to be pulled over unless we're doing something else very foolish because we we get told that it's relatively safe. It's not worth their time, so it's safe for us to do. And that's just not true. It's just absolutely not true. Um, so we have to get back on track with this. And to do that, we need to prepare ourselves and those taking care of us um, with the right information that they need in order to bring this information forward. And right now, that's largely focused on provider education, doctors, nurses, physicians, assistants, clinic workers. They're the trusted source. They're still the ones who are the trusted source. They can talk to patients and say, hey, look, right now you're having this issue. We need to do this treatment. We need to give you this pill. Well, they are the ones who can bring up the perception of risk with a large sect of the population. And it really is a one-on-one thing. But sometimes that one-on-one conversation can become conflictual. We will have men and women who are going to bring challenging beliefs and misnomers into the office, and we're going to need to meet that resistance with non-judgmental kindness. Um, we're going to need to prove their risk is actually greater than they perceive. We're going to need to prove that the pseudoscience that they've seen on social media and the outright lies are not accurate, and we're going to need to find a way to communicate that in a way that doesn't become off-putting to them. Um, and have those difficult conversations. And that's a very tough thing to do, right? Because there is that whole spectrum we talked about earlier where you're going to have people who you don't even need to have that discussion with. And then you're going to have these people who are always going to find a hole in your logic without ever seeking or acknowledging the hole in theirs. And that is a difficult thing. Um, because while we can't get everybody on board, we need, excuse me, we need to get as many people on board as possible. We talked earlier about that herd immunity and needing 95%. And I like to bring in an old television clip from Penn and Teller from their show Bullshit that aired a long time ago on a cable network. I believe it was Showtime, where they got to be a little more crass and direct about things, um, like vaccination herd immunity, where they showed that one uh, autism, which is something that people still hold on to despite that one study being completely redacted in 2010 and even partially redacted back in the 90s. Vaccines don't cause autism, but people still hold on to that study, and that misnomer has proliferated through further and further, and it is even proliferating in our government right now, with the current head of the Health and Human Services, Department of Health and Human Services, Dr. Kennedy being a former a current um, advocate for the lessening of vaccines, talking about not needing it and really championing personal choice because of this misguided fear of autism. Um, and this stuff is, you can see just by how we're talking about these things, how complicated these conversations are going to be, and they can roll with them. We need to prepare our providers and even ourselves as public health professionals who will need to back up and even provide some of this education to our doctors. We need to provide the strength to them to make sure that they are ready for this. And how do we do that? Well, the COVID has brought us the ability for online training to just absolutely proliferate at an exponential rate, and we have train.org. These are sources um, these are sources that are current, they are up to date, and as new trainings become available, they compound on the old trainings so that we can lay the foundational layer and then keep building on top of it. And some of that needs to be foundational knowledge, like the challenge of vaccine hesitancy in the COVID-19 pandemic, to there never was an age of reason, vaccines, vaccine hesitancy, and vaccine decision making, to prepare us for those conversations, to the landscape of it. That whole spectrum I talked about earlier, and who is on it and why we're there with it. These are things that we need to do. And then there's also really talking about the science of vaccines and autism, and showing how that study is misguided and bringing that down to a level that everybody can understand, even if they don't have a vast education in the scientific world and how these studies are done, removing the gobbledygook, as we like to say. And then we need to direct our patients to the CDC. There is still a website that hasn't been touched by them as of the recording of this, about immunization and vaccine campaigns. And what it does is it goes into the history of things like German measles and polio, and how we moved from a state of fear to a state of concern and into a state of strength where we have eliminated these viruses and what the risks are of going back. Like I said, we're losing that generational knowledge of people who saw these things happening. And when we lose that generational knowledge, we lose that voice that reminds us, hey, this is still a real risk. And if we do not take proactive steps to prevent it, it will return. And we're already seeing that. We have multiple outbreaks of measles in Texas and Florida and in the Midwest, where um, anti-vaccination has really taken hold. There's a community in Texas undergoing multiple outbreaks right now, and just before all this, they were champions of the fact that they weren't vaccinating. They were the ones that had beat the need to vaccinate, and they were not going to uh, ever have to show up and do that because of their personal rights and their personal decisions. And now they have children getting sick and ending up with long-term disabilities, and even some dying from something that all would take was just a small shot in the arm that did not pose a significant risk to them. I'm not saying anything is risk-free. We can all have an allergic reaction, and there's still 0.2% of the population that can't get a vaccination for a medical reason. But when you have 3.4% of children not being vaccinated because of personal belief of their parents, where the child really has no say because they have no knowledge of the problem, they are being put at risk. you know, and that's part of what we need to do moving forward, right? The time for prevention of return has passed. We have these outbreaks again. We are going to begin seeing this more as it takes time to break through these barriers of the hesitancy and finding late adopters and laggards and converting them into people who are willing to do this. Um, like I said, the outbreaks of measles in Texas and the backlash from the COVID-19 pandemic has definitely exacerbated this problem. As I said just a moment ago, the 3.4% of children that have not been vaccinated because of their parents' personal belief, there's proof that a lot of this is actually exacerbated from COVID-19. For children who were 7 months at the time of May 2020, only 72% of those children nationwide were actually up to date on their vaccination schedule compared to 82% for those of them up to February in 2019, from February 2019 to February 2020. And at 18 months, this only gets worse. It's 56% of children not, who were up to date on their vaccination in 18 months compared to 61% before COVID started. And we shouldn't jump on and say that it is only anti-vaccination that caused those jumps in numbers too. We have to acknowledge that during that time there was difficulty getting doctor's appointments. There was difficulty getting in to see doctors because so many people were worried about having a COVID infection, needing to get tested, and needing to protect those workers, and even some of our doctors having to convert from being primary care clinicians to hospital clinicians to deal with surges that would happen, compounded by other respiratory viruses like the flu and RSV during that time. Um, and you know, we need to reach. This is a subsect of our population, these children that we need to reach. Right, we need to focus on making sure that as they get older, and they begin to make their own medical decisions, and they do have a choice, that they have the knowledge to make an informed decision, not simply falling back on, well, this is the way my family has always done it. Change doesn't always happen from the parents. Sometimes it has to happen from the children. um, and this is one of those times where the children, as they become adults, are going to need to make the change themselves, and we need to harness the power of social media in doing this. Like I said, confirmation bias is what keeps us addicted to social media. It's what keeps us engaged with it. And this is what we have to use to combat it. And it's going to take time. It's going to learn how to overcome the fear that makes confirmation bias so easy to seek, and turn it into a strength where we use this tool to bring empowerment. And it has to not only just come from us as public health professionals and putting a doctor on TV, because you can see just as easily as we can say these things, so can those on the other side, especially right now as they are in control in our national government and are making changes and decisions based on pseudoscience and misnomers, and silencing those who try to speak out against it. I definitely want to bring everything to your attention as to where I got these things. So I've put my references here at the end of the slideshow. I encourage you to take a look at them. Also, please feel free to contact me. I look forward to your feedback on my presentation in our forum. And if you have any questions, please reach out. If you have any comments, I'm more than happy to hear them. Otherwise, I wish you all a good day, and I hope to see your presentations as well, and hope that I can bring some good information to yours and help us improve as a group. Thank you very much, and have a good day.